Hey y'all, how's it going? So today I wanted to discuss birth control with you guys. There are so many choices. How do you decide what is right for you? One decision that works for one woman is not necessarily going to be the best option for the next woman. Let's jump right in and let's get this discussion started. So when we're talking about birth control, we got to think about all the options, from non-hormonal, over-the-counter methods to prescriptions, short-term use, long-term use. What is right for you? The first thing you're going to need to decide is, what are your long-term plans? Do we plan on having a baby or starting a family in a year? Are we wanting to wait 2 years, 5 years? Are you done with childbearing, done with having a baby? Or do you not want any children at all? So all these things are important when you talk about birth control and what's right for you. Now, this doesn't apply to women who have contraindications for using birth control, like women who've had previous blood clots, certain underlying autoimmune disorders, bad side effects, allergic to anything or ingredients in the medication. So this is not for you per se. Let's start with the easiest, over the counter. You've got condoms, you've got spermicides, and while they work and they have their place, the efficacy, how well they work, is not as well as the prescribed hormonal options. The natural family planning, and that's going to be the pull-out method. That's going to be timing your periods and tracking your ovulation, basal body temperatures, things like that, that you have to be very in tune with your body. You can't just do it as a fluke one time and say, oh, well, I think I'm ovulating, and use that as a reliable form of birth control. The next easiest method, we start to get into the medications. We're looking at birth control pills. There are a lot of options of birth control pills that are out there. And what is going to work for you, that's going to be a discussion with your provider. As a provider, I like to start all of my patients that want to go the birth control route on the lowest dose of hormone that I can get their insurance company to cover. When you look at the hormone levels, the higher the hormone level, the higher the risk of side effects. So I always like to go with the lowest dose, which can, not only offer the birth control benefit, but can decrease cramping, can shorten, lighten, or stop periods. So there's all kinds of benefits. Then the next method would be your NuvaRing, and I kind of lump it with the patch. And those are both combined methods that have estrogen and progesterone in them. The patch you put on your arm over an area where no bones, so just on the soft tissue. Ring. The NuvaRing is a little round ring that you put in vaginally. You leave it in for 3 weeks, take it out for a week. Your next option is going to be Depo-Provera. And Depo, for short, is an injectable birth control method that is a progesterone-only method. And you get the injection once every 3 months. Once you get past the Depo, then you're getting into the more long-term methods, which are going to be the Nexplanon implanted in the arm, good for up to 3 years, progesterone-only method. Then you go IUDs. So you've got a 3-year IUD, a 5-year IUD, an 8-year IUD, an 8-year IUD. All those are all hormonal and can potentially lighten or stop your period. Then you've got the non-hormonal IUD, and it's good for up to 10 years. Now, the biggest thing with any method of birth control that you look at starting, it takes your body time to get adjusted to the hormones and how it's going to respond. So usually about 3 months is going to be the time for pills, the patch, the ring, the Depo to get working. Irregular bleeding can be possible for up to 6 months with the Depo-Provera, with any of the IUDs, or with the Nexplanon. And the irregular bleeding may be anywhere from nothing to just prolonged episodes of bleeding. Again, we as providers do not know which woman is going to bleed longer, which woman's not. So it's just a conversation that you need to have with your provider to see what is going to be the best option. And the one conversation I have with my patients is you need to, at 100% of the time, make sure that you are educated with what you're putting in your body and with the side effects that I may not have reviewed, because it's almost impossible to go over every side effect of any medication. And so, you need to make sure that you have reviewed your history with your provider. If you have uncontrolled hypertension, some of these medicines may not be good for you. Like I said previously, if you have a history of blood clots, almost none of these are going to be good for you except for maybe the IUD methods. And when we're looking at the methods, you've heard me say estrogen and progesterone and the progesterone only. That conversation is going to be something to be had with your provider. And coming in last in the birth control discussion is going to be the permanent birth control. These methods, are obviously, as they sound, reserved for women who are done having children, who don't want to have any children, and who have that conversation with their provider, and their provider is willing to tie their tubes. Then there is the vasectomy, which is the male form of sterilization. So these methods are all encompassing whenever we talk about birth control and figuring out what is right for you, what is going to work best for you, what you're comfortable with. Because if you're not comfortable with the birth control that you're using, you're not going to be happy with it. And having that conversation again with your provider, having those open lines of communication, talk to your provider about what you're uncomfortable with and what your concerns are, and then not just taking the prescription and going out the door with nothing, because then you leave yourself open for unwanted pregnancy. And so I hope this discussion has been helpful for you today. Just give me a like and subscribe down below. And if you have any questions or comments or concerns, just put them in the comments below or send me a message, and I will do what I can to address your concerns or answer your questions. Thanks. Y'all have a great day.